Hi, I'm Dr. Martin. In this video, we will be presenting you our innovative new device to treat anal fissures, FISSCURE.
FISSCURE was designed to make the process of injecting botulinum toxin into the internal anal sphincter simple, standardized, and more effective, while reducing the safety risk posed to the operator by needle stick injuries. There's already abundant medical literature on the use of botulinum toxin as a treatment for anal fissures, so this video will focus on how to use FISSCURE in a treatment setting.
We will start out by checking that our device is ready for use. We start by pressing the button and turning the handle clockwise to release the needles. Red marks should now be visible. Now that this is done, we can retract the needles by pressing the button and turning the handle counterclockwise, at which point green marks should be visible. There is no need to keep the button pressed during the handle movement. Our next step is to connect the syringe containing 2 ml of botulinum toxin preparation. The needles should now be deployed. The empty space of the fluid pad should be filled with the drug. Be careful to do this very gently in order to not spill any of the solution. As soon as a drop is visible at one of the needle tips, stop pressing the plunger and retract the needles. Before the procedure, we must do a digital examination to measure the length of the patient's anal canal and appraise its tonus. In this case, the estimated length of the anal canal is 4 cm. So we plan to inject the botulinum toxin into the internal anal sphincter 2 cm from the anal verge. Next, we will be inserting our FISSCURE device into the patient's anal canal. According to the patient's pain tolerance and the severity of the anal spasm, it may be necessary to sedate the patient. Coat the device with a little lubricant and introduce it in a slow and gentle manner into the patient's anal canal. As we are injecting at a depth of 2 cm, continue insertion until the anal verge is flush with the 2 marked on the side of the device. Once the device is correctly placed, stabilize it with one hand while maintaining the button pressed in. With the other hand, turn the handle clockwise to release the needles. Gently pull the plunger, and if no blood becomes visible, apply pressure on the plunger and inject the solution. After administration, press on the button again, turn the handle counterclockwise to retract the needles. You should hear a little creak and the green marks should again appear. You now can remove the device. Our last step is to verify that the needles on the device are still intact. If that is the case, dispose of it according to protocol. This concludes our presentation. Thank you for watching.